Let's just put it that way. And let's go over to the phones here. We got our deep dive into COVID-19 news, but we wanted to get Senator Democrat Clynt Ridgell on to talk about a Facebook post that he had about recovery. And this was quite a lengthy one, Senator. I don't know if we have the time to read the whole thing, so we just wanted to get you on to kind of talk about ahead of the governor's release of her plan. Mm-hmm. What are your 2 cents on recovering, Senator Clynt Ridgell? Good morning.
Good morning.
Hi, good morning. Yeah, so I think we do need to start thinking about how do we recover. And I said this during session the other week when we were voting on, the bills that would have allowed, when we were talking about the bill, the 2 bills, the curfew bill and the other bill that would have allowed for penalties for violating the executive order. I basically said that, I don't think the executive order or the curfew is necessary at this time because I think we're doing good in containing COVID. And I think now's the time to start sort of switching gears and thinking about how we can reopen the island, but not immediately. We have to reopen in phases, and that's a lot of what my post was kind of talking about. And this is because this is my take on it after doing there's a lot of my own research and looking at what's happening in other countries and the countries who have successfully contained COVID and what they're doing and how they're handling it. And a lot of those countries are Asian countries. I'm talking about Taiwan, Hong Kong, South Korea, Japan, Singapore. Those countries, none of them have really done full-on lockdowns. Each country's kind of done it differently, to different degrees. But for the most part, those countries haven't really done any real lockdowns. They'll do some social distancing here and there, and they sort of, if they see a spike somewhere, then they start clamping down a little bit, right? And then other than that, they're letting a lot of their operations run, pretty open compared to the rest of the world. I have a friend in South Korea right now saying that they've never really been on lockdown ever. They just kind of, certain areas here and there, they will close and say, okay, maybe you guys shouldn't have this open. I read some articles where in Japan and South Korea, they've got karaoke bars open. And I believe in South Korea, there was a little bit of an outbreak that it started making a comeback, and they traced it to karaoke bars because too many people were hanging out in karaoke bars, some people were sick. And there's a lot of evidence showing that singing and loud talking helps to spread the disease because it causes you to aerosolize the virus.
Right,
basically,
the droplets.
The virus into little aerosol droplets when you're yelling or you're singing, and then that causes it to float around in the air and infect other people. So they were tracing some little spikes in areas in South Korea where there were people. It was coming from karaoke establishments. People were still. And so when I read that article, I was just like, wow, these guys are still, they got karaoke bars open and stuff. They're leaving a lot of different things open. So just in looking at all these different countries and what they're doing, a lot of it is, of course, testing is a major factor.
Right.
You got to make sure that the testing is on point. But also, and contact tracing is a big part of it. So I kind of, in the post I posted to Facebook, I think that's what you're referring to, right? I sort of laid out some things that I think we need to do going forward. And of course, that's improve our testing and expand it. And of course, they're working on doing that. That's why they did the pilot project this weekend. Of course, we have to hammer out some more details and make sure they get it right. But I think it's a good start. So I think if we can increase testing, we can get better data and see where our numbers actually lie.
How much more testing, Senator, do you think we need to do before you guys can reasonably say, all right, we know where we're at with COVID, let's start opening up stuff?
Well, I mean, I can't say. That's really that's something for experts to figure out. I'm not a medical expert. I'm not a mathematician. That's where you need a medical expert and a statistician, really, to figure out what do these numbers mean. I've done some of my own tracking, but like I said, I'm not a statistician. But from what I've seen, what I've done a lot of with my own tracking is I look a lot at what are the percentages based on the batches, right? So, for example, you can sort of see. Basically, I've been tracking the numbers myself personally, kind of like a madman over here, because I'm just trying to get an understanding.
You're like the Peter Lombard of the Guam legislature, maybe.
In a way, I came to a lot of the same findings Peter Lombard did. And it was just based on, but mine was very simple, rudimentary math. I didn't It wasn't as detailed as Lombard's. So, but what I was looking at was, I'm looking for patterns, I'm looking for anomalies, and so the first thing I did is I started trying to figure out patterns, right? So the first patterns I noticed, I started figuring out, okay, whenever we test, say, 30 some people, we would normally get X number of people positive, right? Or when we would have a batch of 20, you would see X number of people positive out of 20. So that kind of gave me like a baseline to figure out, and you could see it too. You could see it increasing when I think we were closer to our peak. I'll give an example, like I would say, like when we're kind of seeing like what I would consider our peak. Say they would test 20 people, they could easily find 3 positives out of 20 or 4 positives out of 20 even. And now when they're testing 20, it's either 0 or 1. I mean, the other day there was 1, but for the most part, there's been a lot of zeros. When we were testing in the high 30s to low 40s, you would see anywhere from a range of like 3 to 6 positives in those batches. Now we're seeing zeros. So that's what I'm looking at. I mean, I'm kind of basing it off of that. So if you see that, and actually you could see the numbers going down over time. So if you see that going down over time, that shows that we're heading in the right direction. And also you look at the hospitalization. I think there was a report that I think there's only 1 person in the hospital due to COVID right now. If we were really on track the way it was looking in the beginning, our hospitals should be like bursting at the seams by now. And that's what a lot of the thoughts were, that by, sort of by the end of April, around May, we'll start seeing these huge surges at the hospital. We're not seeing it. It went in reverse, actually. Now there's less people in the hospital due to COVID-19. So I think those are all strong indicators that we're doing a good job of controlling it. So with that, I think now it's the time to start looking at how do we reopen. Now, that doesn't mean reopen right away. I think, so to sort of put it simply, the type of reopening I'm envisioning, it would have to be something, it's like taking baby steps, right? So you got to take one little baby step forward. You sort of peek around the wall a little bit, take a baby step forward, make sure the coast is clear, and then there has to be a waiting period. And the reason there has to be a waiting period is you got to wait and see what the effects were of that baby step. Yeah. So you sort of take that baby step forward, and whatever it is, that's what the governor's team is going to have to figure out. And I'm sure that's what they're working on now. Right. Now, I heard you guys say that maybe some senators have seen it. I'll be clear, I haven't seen it. I have no idea what they're working on. Okay.
Do you feel that you should be privy to it as a member of the...
I would like to, but they've got their own team sort of working on it, and I don't know how much I would have been able to add to it. I sure would have. I'm willing to help if need be, but should I see an advanced copy of it? Is that what you're saying? Or,
yeah.
Yeah, you guys are kind of like a branch of government.
Sure, but I don't know if there's an advanced copy available yet.
Right.
I think there's still. Things are happening very quickly.
It's rapidly evolving. Say it.
Yeah. It is. That's the truth. The whole world is rapidly evolving. The whole world comes out and says one thing, and then each country will do one thing and then change their mind, and then wait, that's not working. We got to do this. This is a brand new virus, and I think that's one thing people forget is that the whole world is grappling with this thing. And I kind of said it early on in the beginning. I think when I was on your guys' show, I said, this is something that's new to the whole world. You got the leading scientists around the world will put out a report and then say, wait a minute, actually, we're a little bit wrong with that.
Right.
You got you have manufacturers making tests and then saying, wait a minute, that test is bad. The CDC rolled out a batch of tests and then recalled them. That was the first batch of tests. This is the CDC. This is our leading experts from the U.S. They rolled out batches of tests and said, wait a minute, those tests are bad, and recalled them, and then had to put out another batch of tests, which is another reason why we're behind in testing, and the whole nation is behind in testing. You got people screaming at the president to do more tests, and the president's saying it's fine, it's perfect. Everyone who wants to get tested can get tested. And then it turns out he's wrong. Not everyone who wants to get tested can get tested. You've got manufacturers like that Abbott company where rolling out tests and then coming back later and then saying, oh, wait a minute, don't put it in the vial of the serum or whatever. That's diluted. Yeah, we just figured that out now.
Right.
So things are changing constantly, and it's because this is something that's brand new that the world has never really dealt with in this way before.
Right.
In the whole way.
What about your baby steps, Senator? Let's just fast forward to you talk about opening and baby steps. What would be the first baby step that you would take?
Well, I mean, for me personally, I don't know. That would be just this really requires a lot of serious thinking and sitting down with people. So I couldn't say for sure exactly. You need all the experts. You need to have all the medical experts there. You need to have the statisticians there and the medical experts, and just to figure it out. But it's whatever they have to set it somewhere. I would say start conservatively. I would say start with a few things that limit as much as possible human-to-human contact. I would say start out with things like that. Now, what exactly does that mean? I don't know. I'd have to look at all the different sectors of the economy.
But do you think it's something they could whip together in a weekend?
Maybe in a week if you have the right experts. If you have the right experts around, you can figure it out in about a week. I mean, and then adjust it as we go. So that's what's going to require. It's going to require a lot of adjusting as we go. So the idea is you take a baby step forward. You wait and see. Now, how long do you wait? Again, that's up to the medical experts.
Right.
Now, I would say a minimum 2 weeks, only because they talk about the incubation period could be 14 days, right? Whatever for symptoms present. So I would start there, maybe a minimum 2 weeks, but I think probably a month would probably be even safer, right? So take the first baby step, wait 2 weeks to a month.
But then also,
the numbers.
On the government side, the testing capability would have to be there. If we're going to take a baby step and then we're going to watch and see if there's any ripple effect as far as like COVID or COVID exposure, then it also has to be coupled with the government going in and, getting really serious about testing people.
Well, I mean, that's what Dr. Felix Cabrera said, that a big chunk of the decision to reopen and how we're going to reopen is based on our testing capacity. And by increasing testing, then it gives the decision makers a better idea just how widespread COVID is. But, as we saw over the weekend, there was a total of 84.
Right. Not 258, right? Is 84 258 a day? Because I'm not good at math.
Yeah, no. I mean, I saw some reports that they wanted to do 200 a day.
Right.
So that would be a good start. If we could get like 200 tests a day. But it sounds like it's difficult because there's people just not showing up to get tested. So I don't know what the details are behind that, but I mean, I imagine some people are probably scared to get tested.
Sure.
I've been dealing with people, messaging and commenting. I think there's some fear out there that if you get tested, you'll get yanked from your home and thrown in like quarantine jail.
I mean, it's really the words they're using, Senator. I mean, yanked from your home.
Yeah, it's a misunderstanding. Mm-hmm. So I actually clarified that. I actually spoke to the communications department at Adaloop because people were asking me, and I clarified it. No, what they were referring to is.
Did you get 2 questions or more?
Did they mute you or?
No, I sent a message.
Oh, okay.
See, you got to email your question.
That's it, right
so
on.
I sent a message over WhatsApp, and then I got a response. So what happened was basically it's a multi-generational thing. So my home is a prime example, right? So my parents live with me. It's like me, my wife, my kids, and my parents. Say I test positive, and my house is too small for me to really be able to isolate myself. And I think public health looks at a couple things. I've spoken to people at public health in the past before that said one of the things they look at is sort of like, can that individual isolate themselves within the home? In other words, does that individual have their own room that's separate from the rest of the people? Is the house big enough, basically? Does that individual have his or her own restroom is a big thing, too, that they can use that the rest of the house doesn't need to use? And those types of things they look at. So in that case, I would have to be put elsewhere. I would volunteer myself if I testify. I'd say, get me out. My house is too small. There's no way I'm going to avoid my family, my parents, if I test positive. I would actually be begging them, you got to stick me somewhere else because there's no way I can avoid them with the way our house is set up. So that's the type of thing they're looking at, and that's where they're talking about putting someone into a facility. And you're right, maybe it is a poor word choice to say like yank from the home.
Well, we're not saying that. We've been very consistent with our message from public health, but there's media out there just irresponsible, really, the way they're going to present that. And, I mean, it's a public health emergency. We want to encourage people to go out and test them, not use, fear tactics because you're partisan. It's ridiculous.
And I know that they're allowing that because I can say with confidence, I know specifically of an individual who tested positive, who was left in his home, and he had 2 people living with him, and it's because they actually went out and they assessed the home, and they said, okay, your home is such that you use this restroom, you stay in your room, and you guys stay away from him, and you'll be fine. And he's fine, and none of the 2 people that live with him, roommates, neither of them got it. They all tested negative.
Right. Yeah.
And the guy who was positive, he's now negative, and he's totally recovered and everything. So you can do it, and I know specifically of an individual where they did do it that way. So that's why they're not going to be just yanking everyone and throwing them in a quarantine jail
isolation facility. Right, yeah.
Yeah. So, I guess back with the baby steps kind of thing, right? So I think you take that baby step, you wait 2 weeks to a month, and you see where the numbers are at. And you're right, we're going to need some more testing to be certain. But at the same time, we can still glean a lot of information, even just with the level of testing we've done now. Say if they keep that testing, you can still see a spike. Because if you're testing in those batches, like I said, you take a look. Out of 20 people, how many were positive? All right, normally out of 20 people, how many have been testing positive? You take a look at 37 people and you say, all right, how many tested positive today? Okay, normally out of a batch of 37, how many are testing positive normally prior to whatever baby step we took, right? And then that's where you can see the spike. And if you see any spike right away, then you take that baby step back and you just go right back behind the wall. You reassess everything, and then you probably have to come up with a new baby step or something else that won't evoke that same response. Because what's happened in some other countries is they have opened up a little too much. There's a prefecture in Japan, I think in Hokkaido, if I'm not mistaken. There's some articles now showing that they opened up and they relaxed too much. They had some weekend where they had people were out partying and they're on the streets and filling the cafes. And on top of that, they had people from other areas within Japan that were infected were flocking to Hokkaido because they heard that the restrictions were opened in the Hokkaido. So other places where it was more restrictive, people were going there, probably to get away and have fun.
Right.
And they brought in more infections.
Even Singapore, I think, too, right, Senator?
They saw a huge spike. Yeah. So pretty much all these places are seeing little eruptions here and there, little outbreaks here and there. So that's the way forward, really, is to move slowly and carefully. And then when you do see, the minute you see a little outbreak or a little eruption or a little spike, whatever you want to call it, you got to snuff it out right away. You got to stop what you're doing, go snuff that out. And that's the only way to do that is to contact tracing, aggressive contact tracing. Something else I wrote about in my post.
Right.
What a lot of the countries are doing is they're using technology for contact tracing. Now, some countries are taking it probably farther than Americans would want to take it because there comes in ideas of civil liberties and privacy. I'll give you an example. In South Korea, they go as far as they track your credit card purchases. So in other words, if I were to test positive, South Korean government could take a look at, okay, where have you been? Now I would tell them, okay, well, in the last week I went here, here, and there. They take it a step further. They look at my credit card purchases and see what stores and restaurants I was at.
Right.
And then they say, oh, well, you were at this restaurant. You forgot about that one. Then they go and they contact trace in that restaurant, and then they test individuals in that restaurant. And I think they also they have apps that track where people have been. Wow. And then they report that out to the public. So they actually tell the public, like, don't go to this restaurant. There were infected people at that restaurant.
Yeah. So, I mean, Senator, what you're saying is that basically there hasn't really been a success story in the COVID recovery, and places that are semi-successful, I guess is how you would say it, have way more advanced technological and medical ability. So that's why I think it's are we going to be the first place in the world to recover from COVID? Hell no. There's no way. And so I think that just proceed cautiously, like you said, and then, couple that with the testing that we need to do before we implement any recovery plan. Senator, we got to run. We got to do news. There's a whole bunch of stuff going on. But I just wanted to get you on and kind of bend your ear a little bit about your 2 cents on the recovery plan. Appreciate it.
Yeah, it's gonna be challenging, but before we go, if I can just say, I do believe it's possible. If there's a will, there's a way. We can do it. We just got to be careful and methodical in our approach.
All right, thanks.
Thank you.
Thank you.
All right, careful and methodical. 2 words you don't really associate with the government of Guam. Sorry, that's just saying. 8:27. We're taking a little break. We'll come back with Sabrina doing a deep dive into COVID-19 news, and then we'll get Senator Regine Bisco-Lee to talk about her letter that was written to the governor. It's 8:28. Again, containing COVID. The KUAM News Takeover, Guam's favorite, I-94.
Join us. Keeping you informed. KUAM News brings you banking